Let's now shift our attention to the other big story that we are tracking on WION, and this, of course, has got to do with the Nipah virus infections that have been reported in the state of Kerala. The Indian state is now ramping up efforts to stop a potential outbreak of the deadly Nipah virus. This is one more person is now tested positive for the Nipah virus that still, remember, has got no vaccine whatsoever. Now, the number of infections so far stands at 6, and at least about 2 people reportedly have succumbed to this fatal outbreak this year. Now, India has reached out to Australia seeking to restock the monoclonal antibody doses to combat the Nipah virus. And as per the Indian Council of Medical Research, at least about 20 more doses are expected to arrive in India soon. While the restocking of the monoclonal antibodies has been said, the antibody, remember, is not a vaccine, and at this moment its efficacy is also in question. Now, the option of administering it has been left to the patients and the family members. Now, the high mortality rate of about 40 to 70% has in fact sent the state and central government rushing to limit the spread through aggressive contact tracking. And as per the numbers that have been released by the Health Office, nearly about 700 contacts have been identified, of which 77 are in fact considered to be pretty high risk. Now, Kerala is currently battling its 4th outbreak of the virus since 2018, when 21 of the 23 infected people in fact died. While for India, this is of course the 6th stride of the deadly outbreak since 2001. The Nipah's most lethal attack in India was the very first one back in 2018, when 66 cases had been recorded in West Bengal, of which 45 proved to be fatal. This happened in 2001. The travel restrictions were put in place in the containment zones in Kerala, and also in public gatherings have been banned. Moreover, educational institutes have been shut. Researchers in India have found the evidence for the presence of the virus in bat populations across 9 Indian states and 1 union territory. Now, the species of the fruit bat, commonly called flying foxes, are the known carriers of the virus. Now, the virus in fact spreads to humans from animals through contaminated food, or it can also be transmitted directly between people. Now, the question, of course, is to try and stop the spread of this virus, and also it's important at this moment to carry out the containment of those who may have come in contact with people who may have had this infection. Now, there are various reasons as to why this virus is set to spread, and that is because of the possibility of increased possibility of the virus jumping from animals to humans. Now, experts suggest there are factors like climate change, globalization and deforestation that are to be blamed, while industrial farming has increased the risk of pathogens spreading between animals. The deforestation has heightened contact between wildlife, domestic animals and humans, and this in turn has made the spread fairly easy. Now, climate change has also driven many animals to flee from their ecosystems to try and search for more livable ecosystems. And according to research, thousands of unknown viruses from mammals and birds have the capacity to in fact jump from animals onto humans. All right, now to help us understand as to how all of this is of course happening and why we are witnessing these kind of infections, we're being joined in by the Director of Tata Institute for Genetics and Society, Dr. Rakesh Mishra, who is joining us on this broadcast. My first question to you is this. We know that the Nipah virus travels from animals. It in fact jumps from animals onto humans through direct transmission, and it can also be transmitted from one individual who's infected to another. So how exactly does the Nipah virus infection spread?
So if we are getting in contact with the body fluid of the animal, which could be blood, urine, nasal secretions, saliva. So these are the things in which the virus will be present. And if that comes in contact with our respiratory epithelial cells, then virus will get infected. So in other words, if you touch something which is wet, which has animal saliva or infected person saliva, and by doing that, after doing that, you touch this with same finger, your food or something, you rub your eyes, nose, mouth or something. So that's the way this virus goes from one person to others.
And also considering the fact that, the fatality rate of the Nipah virus infections is said to be substantially higher. What are the effective ways that we can look out to slow down or even curb the spread of this virus?
So that is really important question, and that's what we should focus on. Since we know how the virus spreads, and it's unlike SARS-CoV-2, where that was airborne, this virus does not have that route. So it will infect only if we are in very close contact with the infectious material, which can be samples or discards from the patients or the infected animals or the meat of infected animal that goes. So once we know this, then what we have to do is that we touch these things with the gloves and discard them properly. Of course, wearing mask is a good idea when you know that there may be infection around, because sometimes small droplets can be hanging around and that may come through breathing. And if you are eating material which you suspect is from infected zone, then you should heat at least 100 degrees for a few minutes, and then this virus gets infected, gets killed. Also, the virus is very easily killed by soap and detergents and hypochlorites, which is generally used for disinfection. So this is not resistant to any of those things. So if we, after doing whatever we are doing in a suspected region, we should do a proper hand wash. And while we are in those regions, protect ourselves with the gloves and with the mask, and avoid eating fruit or food which you suspect may be exposed to things. Like, for example, a fruit that has signs of some damage or have been eaten by some other animals could be a bat, because the fruit bats are the main reservoir for this. If we avoid that, then we'll be pretty safe.